Hello everyone, welcome back to my channel. Today we are going to see about Hyperemesis Gravidarum. Hyper means excessive, emesis means vomit, gravidarum is pregnancy. Hyperemesis gravidarum means excessive vomit during pregnancy. Nausea and moderate intensity are especially common until about 16th week. This hyperemesis gravidarum occurs when vomiting becomes intractable in early pregnancy and cause a fluid and electrolyte imbalances and nutritional deficiency. If mother has this hyperemesis gravidarum means usually needs to be hospitalized. Hyperemesis gravidarum meaning excessive vomiting of pregnant woman. Vomiting is a common one during first trimester of pregnancy. If the vomiting is excessive means then it is called as hyperemesis gravidarum. If the mother has hyperemesis gravidarum means needs to be hospitalized. Definition of this hyperemesis gravidarum. Hyperemesis is a severe form of morning sickness with unrelenting excessive pregnancy related nausea and or vomiting that prevents adequate intake of food and fluids. This hyperemesis gravidarum leads to inadequate intake of food and fluids. If the mother has hyperemesis gravidarum means it prevents the adequate intake of food and fluids. According to Datta, hyperemesis gravidarum is a severe type of vomiting in pregnancy which has got deleterious effect on the health of the mother and or incapacitates her in day-to-day activities. This hyperemesis gravidarum will affect the day-to-day activities of the mother. This will affect the health of the mother as well as day-to-day activities of the mother. Next, more the incidence. Incidence estimates of the percentage of pregnant women affected range from 0.3 to 2 percentage. 0.3 to 2 percentage of all pregnant mothers are affected with this hyperemesis gravidarum, and it affects about 1 in every 300 pregnant women. Okay, 1 in every 300 pregnant women are affected with this hyperemesis gravidarum, and it is more common in young women in first pregnancy. It's more common in preemie mothers. Preemie mother means first pregnancy, and in women with multiple pregnancy. If the woman carrying twins, triplets or quadruplets means those are having this common problem. Means hyperemesis gravidarum commonly occur in twin pregnancy or triplets and first pregnancy and also in young women. And also if the mother has any history of hyperemesis gravidarum and trophoblastic disease. Okay, trophoblastic disease is nothing but tumors in the abnormal pregnancies. Next, move on to the causes. Causes of hyperemesis gravidarum or excessive vomiting. The exact cause of hyperemesis gravidarum is unknown. Some theories suggest some kind of theoretical evidences shows the causes of this hyperemesis gravidarum. First one is hormonal theory, second one is psychogenic theory, third one is dietetic deficiency, allergic or immunological basis, and decreased gastric motility. Okay, first one, hormonal changes of pregnancy. First theory is hormonal related theory. Hormonal changes of pregnancy suggest that raised level of beta HCG, beta human chorionic gonadotropin, as it is more common in multiple pregnancies and in gestational trophoblastic disease. This raised level of human chorionic gonadotropin hormone is commonly in the multiple pregnancies and in gestational trophoblastic disease. Okay, multiple pregnancy means if the mother is carrying 2 or more fetuses, and gestational trophoblastic disease means abnormal tumors in the pregnancy. And this abnormal tumors means trophoblastic disease and multiple pregnancy, these and all point to high level of estrogen and progesterone, which may also be to blame for hypersalivation, decreased gastric motility. Okay, these hormones level, increased hormones level will lead to hypersalivation and decreased gastric motility. Gastric motility which cause a slowed emptying of the stomach and intestinal content, and immune response to fragments of chorionic villi that enters the maternal bloodstream, and immune response to the foreign fetus. Okay, this hormonal imbalances means excess increased level of estrogen, progesterone, HCG hormones will lead to hypersalivation and decreased gastric motility and immune responses to the fragments of the chorionic villi. Also, chorionic villi means is the part of placenta. Usually this chorionic villi make up a significant portion of the placenta and serve primarily to increase the surface area by which products from the maternal blood are made available to the fetus. Okay, let's see the pathophysiology. Predisposing factor. Here the predisposing factor is women, that is pregnant women, and etiology, exact etiology or cause is unknown, and precipitating factor here pregnancy. Pregnancy is the precipitating factor. Okay, these will leads to adverse reaction to the hormonal changes of the pregnancy. Okay, some hormonal changes are occur during pregnancy. Here progesterone, increased level of progesterone, estrogen, and HCG hormone, leptin and all, and this will leads to increased level of beta human chorionic gonadotropin and increased level of estrogen and progesterone. Okay, this increased level of hormone will influence gastric motility. It decreased gastric motility caused by increased level of these hormones, and immune response to fragments of chorionic villi that enter the maternal bloodstream. Chorionic villi is a part of placenta, and immune response to the foreign fetus. Okay, this it's related to immunology. Okay, immune response to the foreign fetus. The fetus is considered as a foreign body here. Immune response to the foreign fetus. This will leads to loss of 5% or more of pre-pregnancy body weight and dehydration, then metabolic imbalances, difficulty with daily activities. Mother can't do the daily activities of daily living will be affected. Then food leaving the stomach more slowly. Okay, due to this increased level of hormones, gastric motility will be reduced. Okay, this will leads to food leaving the stomach more slowly, and hypersalivation, increased salivation, nausea and vomiting, then abdominal pain and difficulty in breathing. Okay, this is the pathophysiology. And let's see about the clinical manifestations of Hyperemesis gravidarum. Clinical manifestation, it can be divided into two. First one is early clinical manifestation, second one is late clinical manifestation. First one is early clinical manifestation. Vomiting occurs throughout the day. The mother has vomiting throughout the day. No evidence of dehydration or starvation. Okay, there is no evidence at all dehydration and starvation evidences. Normal day-to-day activities are curtailed means diminished, because mother has the vomiting throughout the day. She has vomiting, so the normal day-to-day activities will be affected. And late clinical manifestations such as, okay, it consists of evidence of dehydration and starvation, but in the early clinical manifestation there is no evidence of dehydration and starvation. Here late clinical manifestation consists of dehydration and starvation. Okay, symptoms such as vomiting with retching. Vomiting with retching means the feeling of gagging without actually producing any vomiting. Only the mother has the feeling of gagging, but vomiting will not produce. Okay, then next one is epigastric pain and constipation. Then urine quantity is diminished. Okay, that is oliguria, decreased urine output. And signs such as dry coated tongue and sunken eyes, acetone smell in breath, tachycardia, hypotension, rise in temperature may be noted, and jaundice is a late future. Later complication is a jaundice, because this Hyperemesis gravidarum mother has increased bilirubin level. So this jaundice is the later complication. And diagnostic evaluation, first one is the urine analysis. small quantity, and dark color urine, high specific gravity greater than 1.025, this indicating concentrated urine linked to inadequate fluid intake and presence of acetone and diminished or even absence of chloride. Then biochemical profile estimation of the serum electrolytes. Okay, here blood urea nitrogen increase in the presence of salt and water depletion, and liver enzymes such as elevation of the liver enzyme usually present, and complete blood count, elevated level of RBC and hematocrit indicating dehydration. Usually this mother has dehydration, so elevated level of RBC and hematocrit. Then urine ketones positive when the body breaks down fat to provide energy in the absence of this absence of glucose, and ophthalmoscopic examination. It required only when seriously ill. If mother has serious hyperemesis gravidarum, if excessive level of hyperemesis gravidarum means we have to see this ophthalmoscopic examination too. Okay, through this we can find retinal hemorrhage, and ECG when there is abnormal serum potassium level, and ultrasonography any other obstetric conditions. Some mother has any other obstetric conditions like a multiple pregnancy and herediform mole means we can do this ultrasonography. And complications due to starvation and dehydration, neurologic complications will occur. Neurologic complications such as Wernicke's encephalopathy, then pontine melanosis, peripheral neuritis, Korsakoff psychosis, and stress ulcer in stomach, esophageal tear or rupture, and jaundice. Okay, due to this complication arise due to starvation and dehydration. Neurologic complications such as Wernicke's encephalopathy means is also called as bed brain, is the presence of neurological symptoms caused by biochemical lesions of the central nervous system. Usually it's due to the vitamin B deficiency, especially vitamin B1 deficiency, thiamine deficiency. The next one is the pontine melanosis. This is also demyelination syndrome. This is due to deficiency of the hyponatremia, deficiency of the sodium, that means hyponatremia. And next one is Korsakoff psychosis, like Wernicke's encephalopathy is due to deficiency of B1, thiamine deficiency, and stress ulcer in stomach, then esophageal tear or rupture, then jaundice. These are all the complications of hyperemesis gravidarum. Then prevention, how we can prevent this hyperemesis gravidarum? Effective management to correct simple vomiting of pregnancy. Principles of management to control vomiting, to correct the fluids, and to correct or to detect complications early. Usually in the then other management such as promoting fluid and nutrition balance. We have to maintain NPO status to allow gastrointestinal tract to rest, and administer anti-emetic drugs, and administer IV fluid, and administer electrolyte replacement therapy, and promoting comfort like hygienic measures such as oral care we can give. Then pay special attention to the environment, making sure to keep the area free of pungent odors. And as the client's noise and vomiting subside, gradually introduce oral fluid and foods in small amounts, and monitor intake and output chart also, and providing support and education, offer reassurance that all interventions are directed toward promoting positive pregnancy outcomes for both woman and fetus, and provide information about the expected plan of care, and teach the client about therapeutic lifestyle changes like avoid stressors and fatigue, and avoid noxious stimuli also. Then as soon as we have to listen to hear concern and feelings by answering all here questions also. Medical management such as hospitalization is very important, and fluid therapy 3 liter 5% dextrose and RL enteral nutrition. Then drug management, anti-emetics like stomatical 5 mg, then promethazone 25 mg or metoclopramide, then hydrocortisone 100 mg IV, then nutritional support like vitamin B1, B6, B12 and vitamin C. Hydrocortisone is the treatment for hypotension. And nursing management. Nursing management is a sympathetic firm handling. That means psychological and social support. We have to provide or educate about the expected plan of care, and we should listen their feelings, and we should answer all the questions of them, and teach about the lifestyle changes, like avoid stresses. Okay, advise the mother to avoid stresses and also fatigue. Then advice to avoid noxious stimuli. That means stimuli, such stimulate the sensation of vomiting. Okay, try to educate about to avoid noxious stimuli, and maintain hyperemesis progress chart, and maintain vital signs chart. Then check blood biochemistry and ECG level. And diet, IV fluids and dry carbohydrates like bread, biscuits. Okay, advised to take dry carbohydrates like bread and biscuits. Then small frequent feeds, advised to take small frequent feeds. And termination of pregnancy is rarely indicates. If the condition is very fatal or very critical, means advised to terminate the pregnancy is rarely indicated. And nursing diagnosis are related to this hyperemesis gravidarum. Anxiety related to perceived proximity of death as manifested by verbal report, irritability, facial tension, trembling and restlessness. Acute pain related to hyperemesis gravidarum as manifested by verbal report and girding behavior. Then ineffective breathing pattern related to pain as evidenced by orthopnea, alterations in depth of breathing and nasal flaring. Deficiency fluid volume related to hyperemesis gravidarum as manifested by hypersalivation, vomiting and dry skin. And as soon as we have to give some advices to avoid tight waistband and eat small frequent meals like 6 meals. Then separate fluid from solid by consuming fluid in between meals, and use high protein supplement, and avoid lying down for at least 2 hours after eating. Then avoid food high in fat, drink herbal tea, and eat food that settle the stomach such as toast or soda. Okay, these are the advice we can give to the mother. Okay, thank you.